Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino. And today I have a special guest, Meryl Fury, who is the president and CEO of Plant-Based Nutrition Movement. And Meryl has an extensive experience in healthcare as a registered nurse with several master's degree in nursing. She's a member of the American College of Lifestyle Medicine. She's on the board of directors of the T. Colin Campbell Center for Nutritional Studies. And I'm just excited to be able to speak with her today. And welcome, Meryl. How are you? Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
I am doing super well. Thank you, Dr. Sabatino. How are you?
I'm good. You know, when I looked at your history, it was interesting to me because you kind of came into this as a teenage girl, and I find that kind of interesting. So give me a little idea, relate your story of, what were the motivations and things that really excited you at that time to really make a choice to go plant-based as a 15-year-old teenage girl?
Yeah. So, it's not that glamorous of a story, actually.
Okay.
So I was 15 years old at that time. So you can do the math and figure out how old I am. Anybody who wants to. I was, 1976 or so. And the price of beef started to climb, like really high. I don't know if you remember anything about that, Dr. Sabatino, but my mother was very upset that she couldn't put 3 square meals on the table every day for the whole family. And so she was super aware, having been trained as a gym teacher, that kids needed certain foods to grow up to be big and strong, right? And meat and dairy were critical for that in 1976, right? So this was a huge upset for the family budget. What was she going to do? She was kind of walking around ranting, is the way it seemed to me. And given that I was very close to my mom, it was really upsetting to see her so distraught about how is she going to put 3 square meals on the table and you kids need to eat meat and all this stuff. So I listened to that for a few weeks. And one weekend I was over my very favorite girlfriend's house, and she had 4 kids in her family, and her mom was going through the same thing, only times 2, right? Because we had 2 kids, she had 4. And same thing, 3 square meals on the table. How are we going to do this? Where are we going to get the extra money? And my girlfriend and I decided that we would just give up eating meat. It would just be that simple. And then there'd be an extra 21 portions of meat for the rest of the family. You could spread it out. You could eat it yourself. We don't care. We just won't eat it. And that's really how it started.
Well, that's pretty radical in the 70s. I got to tell you, at that time, as you well know, were you already interested at that time of going into the healthcare field? Was that something that was attractive to you as early as that time, or did that happen much later?
That was later. So it was actually a result of stopping eating meat that caused me to get interested in health. My mother, being who she was, she wanted an explanation and an accounting of how I was going to get my nutritional needs met if I wasn't eating animals, beef and chicken. And well, actually at the time it started with mammals. I stopped eating mammals. And so I had to do study. I had to be able to answer her in a coherent way that made sense to her about how I was going to maintain myself if I wasn't eating animal products like that. So I started reading, and I was extremely obstinate, really hard-headed. There was nothing she could do. There was no change in it. Once I made the decision and had this pact basically with my girlfriend, there was no going back. I wasn't going to change my mind.
So there were no health issues that prompted this. Many times people have some health concerns or something that they've resolved that really wasn't the case for you. It
No,
really came from that animal standpoint, that sense of compassion and then
no, Frank, not at all. It came from that compassion that my mother was going nuts every day,
okay,
yelling about
you wanted to lighten the load in the household with all the insanity that was going on. Okay. All right.
Exactly. I couldn't have my mother being that upset. I just
Okay.
couldn't do it. She's very important to me, and that she stayed peaceful and calm was really important to my well-being.
And what, in terms of your mother's own path, did any of that affect her to make a move in this direction at all?
Not at all.
Not really, not for a second.
Not even,
It's
no.
just
No.
like my family. I went through the same thing with my own family. I tell people it's one of my great disappointments of all the years I've taught and lectured. They never even heard me speak once. So it's kind of intriguing when that happens. So when you decided to then move in the direction of healthcare, let's go there.
Sure.
And I know that you have been someone that has been involved not only as a nurse, but in your training at a master's level. You've been involved in really taking charge of nurses, really supervising teams of nurses and healthcare professionals. And how does that play with your lifestyle? How does that play with your connection to plant-based lifestyle as you dance through what is a really typical medical model, I guess, when dealing with nurses and healthcare?
Yeah, it's very difficult to square,
Right.
really difficult to square. So I worked, my specialty was public health. I'm retired now, thankfully. But, working in public health, there's a model for that. People come in, they get a diagnosis or whatever, they get the medications, they get the treatment, and they're told to come back in something like 3 weeks or 3 months, whichever one works, right?
Right.
As well as, okay, so that's like just being an in-room patient care, direct patient care kind of nurse. I was in the position, I did that for quite some time. I also did home visits for quite some time. And then I went into management, right, as I moved up the ladder a bit. Very difficult to sit in a room and watch somebody get a diagnosis of diabetes or high blood pressure or heart disease, cancer, and be told no other advice except come back in 3 months and we'll change your medicines or we'll take more labs.
Well, we know the system is really much about disease management and not healthcare, and that's one of the real drawbacks. But at that point, when you were in the throes of that, had you already had the mindset and the knowledge or the understanding that these choices that you were living could not only prevent things, but could also reverse it? Were you already there, or is that something that still needed to evolve at that point in your own mind?
So it was an evolution over time. I know that I was never a sick person, right? I didn't get the flu. I didn't get bronchitis. I didn't get anything like that, ever. And I attributed it a lot to my diet all the time. And I'll tell you, having started this whole journey when I was 15, back then, there weren't a lot of books to read on the subject.
Right.
There was Diet for a Small Planet, which I had and I held very close to my heart, right? And there was Dick Gregory's book. I think it's called Cooking with Mother Nature. Maybe there was one or two others, but there weren't a lot of books to read. So I did this diet change, like I call it as an independent practitioner. I just stopped eating meat and I ate a lot more beans and brown rice and lentils and things like that. I know when I did a lot of experimentation on myself for diet management. So when I would get the beginnings of a sniffles or a cold, or I'd feel any kind of change in the sinuses or anything, I would start eating fruit only, period, nothing else.
Right.
Just fasting on fruit. And that always was able to stop the cold in its tracks and turn it around. So I used natural methods all the time. I did a lot with herbology, medicinal herbs and things like that. So that's
back in those days, Dick Gregory was big advocate of fasting, having worked with Dr. Fulton, an incredible African-American female doc in Chicago. And so were you into any of that? Did you even think about something like, so you were into water fasting back then? Cool.
When I probably did my first water fast when I was 17, and I did it 7 days, 10 days straight. Yeah. And then for a long time, I did fasting probably twice a year for 10 days at a time.
Wow. Okay. Let me ask you this, because I know, we have docs right now, people like Michael Clapper, that are trying to move medicine forward, trying to influence physicians and so on. my experience in the medical profession is that nurses were kind of ahead of the curve, actually, in terms of lifestyle medicine and things of that nature. They often can embrace that a little bit easier than the docs themselves. Have you seen that in your own? I know you supervise nurses, you supervise people that were in the healthcare field. Did you feel that the nurses were more amenable to those kinds of lifestyle interventions over the docs, or what was your experience of that?
That was not my experience.
Okay.
Really not. I spent a lot of time actually as a manager trying to create a particular culture in my clinic that had a lot to do with food and what we brought in for snacks and parties and the potlucks and all of that. I mean, the nurses would go along with it. We'd have large staff meetings. The whole building would shut for the afternoon and we'd have our staff meeting once a month or whatever. And my requirement was that if we were going to do that, okay, we're going to have lunch, we're going to bring in potlucks, and it would always be a plant-based meal that we would have. But it would be a bar. So it'd be like baked potato bar, or it would be a big soup thing or whatever. If people who wanted meat and cheese, then it would be available for them to add to their own plate in a bowl on the side. You can do that over there. But it was, but no, very difficult.
You were ahead of the curve, though, which is great. I'm here with Meryl Fury, the president and CEO of Plant-Based Nutrition Movement, and we're going to take just a few moments to hear from our sponsor, the National Health Association. And now, to put a smile on the sponsors of the National Health Association, you're listening to the Health Science Podcast Show. I want to remind you to visit the National Health Association website, where you'll find incredible resources to support your healthy lifestyle, including plant-exclusive eating without added salt, oil, and sugar. Simply go to healthscience.org or nationalhealthassociation.org. Be sure to check out membership, which is $35 per year for those living within the U.S. and $55 for those living outside the U.S. You'll be amazed at all the information and benefits you'll receive. As a member, you're kept up to date on the latest evidence-based tools for health promotion. You'll receive the incomparable quarterly magazine Health Science, a beautiful 40-page advertising-free publication mailed to your home or offices, loaded with articles, recipes, inspirational stories, and interviews with world leaders in the fields of personal health, plant-based nutrition, water-only fasting, animal rights, and environmental support. And you'll receive details about life-changing events, such as the 2023 NHA Conference set for June 23 to the 25th, 2023 in Cleveland, Ohio, which will be the NHA's 75th annual NHA Conference. I'm your host, Dr. Frank Sabatino, and now back to the show. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Meryl Fury. Let's go into your baby. Let's talk about Plant-Based Nutrition Movement. I know this is your baby. You've created this. You're the CEO. Tell me about how that evolved and how that plays, into the healthcare model that you would love to see, be part of people's lives.
Well, you can probably tell by the smile on my face. I know.
I love that smile. I loved it.
I love it. So I will give credit where credit is due. The organization itself was created by Dr. Stephen Loam, who is an interventional cardiologist, and he was here located in the Chicago area. He created Plant-Based Nutrition Movement as a way to educate people and get the word out about plant-based eating and lifestyle as a way to manage chronic illness, right? Especially heart disease and diabetes, high blood pressure, all those fun things. He was in place as the president and CEO for about a year, and whatever pressures came to be, he stepped away, right? He's still doing what he does. He's still very active in plant-based medicine, but he wound up moving to California and doing his work there. And when he stepped away, I was elected president and CEO of the organization. So for me, honestly, can I call you Frank? Is it all right?
Yes, please. That's fine. Yes. Yeah, that's fine.
Let me tell you, doing this work of making sure I have an active voice in getting this message out to people is something that literally gets me out of bed in the morning.
That's your
And we
passion. That's
love
your
it.
purpose right now. I get that.
It probably started when I was 15 and it has
Yeah.
only grown since then. So we work with anybody really who is interested in moving from unhealthy ways of eating to healthier plant-based ways of eating, and we'll go with them along the spectrum.
Well,
Right.
let me stop you right there, because that's a great place where I want to intervene. I noticed that you do so much grassroots stuff with group and small group, large group education, cooking classes. So when you say that, take me through the actual mechanics of how it happens. How does that take place?
Wow. So many different ways, you know. So
Okay.
let's say I'm also a food for life instructor.
Yeah, I saw that
Um,
with the PCRM, which is
exactly.
fantastic.
Exactly.
And
So
I
it
wanted
can
to ask you about that too. So you brought it up. We'll go there too. I love it.
okay.
Okay.
So it can be something like that, very individual. Someone can come to me and say, "Hey, I'm just not feeling well. I just got a diagnosis of something. I think I need to go plant-based. Can you help me?" So, yep, there's that. There's individual hand holding and coaching that can occur, right? It can be on the level of a class. Let's say if we stick with PCRM, we could say a group of 8 or 10 or 12 or 20 people who want to know more about food for diabetes management or reversal. So we can take them through classes like that, right? We also do large group online events, like we just completed the nutrition, the 6 Million Seeds Child Nutrition Summit. Sorry, I almost forgot what it was called. That was more about child nutrition, all about child nutrition, but that one was a very large event, a summit over 4 days with 11 speakers, right? That was pretty large for us. We also do individual events where we have one provider or maybe two, and they're talking to a particular audience. So, for example, we had Dr. Kim Williams talk, and that was specifically for African Americans about the comorbidities and the impact of nutrition on COVID-19 outcomes. That was one of those. We've also done a session for the Indian population, Indian, Pakistani, Bangladesh,
Right.
and Sri Lanka, right? And that was with two doctors. One was Ashrani Garg, and the other one was Soha Patel. And they talk specifically to that audience. We always include cooking demos. We always have someone who is of that culture speak to the audience and basically act like the MC. So we do it in a lot of different ways. It's
Meryl, do you stream this to larger groups that can't be present with you?
oh,
How does that work?
absolutely,
Yeah.
absolutely.
Tell me about that a little bit.
It's nearly always online, you know. So one of the blessings and curses of COVID is that we had to go home, right? We had to stay inside for a while and get
Yeah.
familiar
Right.
with Zoom. So now it's almost impossible, really, for us to do anything without streaming it online and having it available for everyone. And I think it's a gift, actually, because we have people who show up from California, or this last one, the Child Nutrition Summit, we had people watching from Israel or from the UK, you know, which would
Fantastic.
never have happened
Right.
if we hadn't been online. So
Yeah,
the online environment,
there's a blessing in all of that for sure.
yeah.
I'm here with Meryl Fury, and I would love for you right now to let people know where they would go to find you. You know, what the website is, or any location that you want to share with our audience.
Okay. Well, now I don't memorize those things very well, but
Okay.
we have a website for a plant-based nutrition movement that is pbnm.org. We are in the process of getting our website retooled and updated. So, you know, it's a work in progress right now, but it's still there.
And we're going to put those sites in our show notes too. So don't worry about that.
Excellent.
Whatever you
Excellent.
can't remember, we'll put them in the show
Excellent.
notes for sure.
Thank you. And we certainly have a presence on Facebook and Instagram and on LinkedIn. And it's all under Plant-Based Nutrition Movement. You know, so if you go to Facebook and you plunk in Plant-Based Nutrition Movement, it would come up. Same thing with Instagram. And
as someone who takes care of patients and people myself, there are disturbing trends in health outcome and morbidities in the culture that I want to discuss with you. Because as an African American nurse, a healthcare provider, it's so intriguing that we all know now that we're dealing with a pandemic of obesity in this country. We know that 60 to 70% of people are overweight, and maybe 1 out of 3 are really obese. And one of the most rapidly growing groups of overweight people have been children under the age of 18 over the past 20 plus years. But what's intriguing is we also know that when we look at this population, African Americans, Hispanics are twice as likely to develop type 2 diabetes. They're significantly more likely to develop heart disease. In fact, I was looking at this recent cardia study that was really done under the auspices of the NIH, and they took over 4,000 people in the ages of 18 to 30. And 49% of these people were African Americans, 54% were women. And they discovered significantly that twice as many people that were African Americans were twice as likely to develop type 2 diabetes and heart disease. And when they got into the causes of that, they really found that they were biological factors. They were looking at socioeconomic factors, neighborhoods, geographical location. These people were from the South, the East Coast, the West Coast, the Midwest. And intriguingly, the populations of Hispanic and African Americans in this study had all the biological markers that were much higher than the Caucasian components in this study. So they had more insulin resistance. They had higher body mass index. Their waist-hip ratios were higher. Their triglyceride levels were higher. So all of those biological factors were present. So let me ask you a question. How do you filter that? How do you see your organization dealing with that kind of disparity in these morbid outcomes when we see these select populations that are really suffering to a much greater extent than other parts of our population? How do you reconcile that in your mind, and how do you see your organization maybe making some very positive impact on that?
Yeah, that's a great question, Frank, really. There are so many factors that go into these types of illnesses, right? If we look back at the populations in Africa, right, those types of situations don't exist in the same way. Those kind of markers don't show up in the same way.
Right.
So there's something peculiar about what happens in the United States with people of color, right?
Right.
So one of the things that we find is, and I was just having a conversation with one of the doctors the other day about this. One of the things we find is that the level of stress and inequality that is inherent in this country for people of color has a really big, measurable, as you're saying, impact on the way our bodies are able to process these illnesses and the impacts from, poor diet quality and lack of safety and violence in the neighborhoods and poor education systems. And there's just so many, that go along with living in a society that does not value people who have brown skin. It's a problem, right? So what can our organization do about that? The best thing we can do is educate people to eat well, right? Because we also know that there's these epigenetic factors that kick in and just can make your situation dramatically worse, or they can sort of be prophylactic and keep you a little safer, right? So, and one of the things you can do is manage your diet. That's one of the best things you can do. Then there's the other pillars of lifestyle medicine. There's, getting enough rest and managing your stress and staying away from toxic people and substances. And
well, to your point, though, one of the conclusions of that cardia study was that when they looked at visceral body fat and all of that, their conclusion was that just losing weight, the obesity component, was the thing most contributing to that disparity. And if you can alter that food to really result in that kind of weight change, those biological markers would shift remarkably. So to your point, their conclusion was on point with what you're really discussing right this moment.
Yeah. I mean, what we put in our mouth is probably the single most common, easiest sort of thing that we can control, right?
Right.
Now, there is also the problem of people living in food deserts and not being able to get access to healthy food. That's a whole nother facet of a problem.
Well, that's a whole thing that centers around the subsidy program that exists in the country, which is really targeting lower socioeconomic neighborhoods and things of that nature. Because, look, if you're going to subsidize meat and dairy industries, where these costs of these products would be so high because of the land and water resources that they require, and you're not subsidizing people producing fruits and vegetables, well, you're shifting people into making things a little less expensive from the standpoint of processed and animal-based foods, which only feed these pandemics of diabetes, heart disease, and so on and so forth. So on some basic level, that subsidy process has to be kind of attacked and really torn apart and reconnected, so that we're at least supporting people growing real food like fruits and vegetables for people, right, and making those available in inner cities and communities where perhaps the income is less and the pressures are greater with violence and all of these other kinds of things that people are encountering. So, that's a fundamental issue that I think many people know and feel needs to really, truly be addressed. So,
yeah, totally. Not long ago, just in the last couple of months, we had our first paper published in a journal, of which we're very proud. And the premise of the paper was just what we're talking about, the impact of poor quality food in low income areas that totally wipes out whole zip codes because they can't get access to decent food. Now, there's a whole lot of complicating factors that go into social problems, right? But when they can't even get basic decent food, and what they're fed instead, or what's available instead, is what's available at the local gas station, roller
right,
dogs and greasy cheese pizzas and highly refined stuff. And then we're expecting kids to eat that or whatever's given to them in the school lunch and breakfast programs, which is not very good stuff either. And we want them to sit, and they want them to focus and attend and pay attention and learn and self-regulate and manage all the chaos that goes on in the classroom, never mind what they may have left at home. It just literally destroys the human potential of whole sections of our population.
Well, let me ask you this question, Em, because we know when you've done this long enough, as much as people always argue, one of the arguments that comes up is that this is way too expensive to eat healthy. And we know that if you're buying beans or you're buying rice, these things are not expensive things. So do you do a reorientation in the education through your organization in these more inner city areas to let people say, hey, look, this is how you make this food, and it's not really expensive. You can feed a family of 4 for pennies on the dollar, when instead of thinking you've got to buy these very expensive things. So you do that kind of outreach, that community outreach?
Yeah, we do. Actually, we mostly right now, our project is working with children specifically. And there's always these pesky adults that come along with the kids, you can't get rid of them. So we focus on teaching the children, and by extension, their adults, how you cook, where do you find this food? How do you make it so that it's appetizing? And then when the questions come about, the parents will ask, so what about the protein, and don't I need calcium for my bones? And, these Beyond Burgers are so expensive and things like that. Yeah. Perfect openings to have those conversations. Also within the Food for Life realm, if I have done courses that are specifically for African-American populations.
Beautiful.
And let me just say, not all African-American populations are destitute or poor, right? There's
no, of course not.
That are well off, right?
Right.
But when we're doing those kind of classes and the questions come up, okay, well, how do I make this stuff palatable? How do this doesn't taste good. This is bland. This is boring. Right. I couldn't feed this to my family. They would, they'd push it away.
Trust me, for 30 years, there's plenty of wealthy people that eat crap. We know that. It's not,
that's
having money doesn't make you knowledgeable enough sometimes to make these kinds of changes.
At all.
Let me touch on an epigenetic point, because you brought that up, and I really I think this is worth a discussion with the audience briefly. They talk about the fact that when you look at the African-American population, have the worst high blood pressure on the planet. I mean, it's really talked about that way. And now what's come out, that there's the discovery of a gene for salt sensitivity that seems to be more dominant in the African-American population. So we wind up starting to dance around the importance of the lifestyle choice and get lost in the underlying genetic feature. And that's true that there may be some predisposition, but let people know that this whole field of epigenetics has clearly shown that regardless of most of the underlying genetic architecture, those day-to-day choices that we make in how we eat and how we move and how we handle stress can literally modify how those genetics are expressing in a more positive or negative way. Just touch on that briefly for the audience.
I'll just give you my personal experience. Okay. I come from a long line of people who had cancers and blood pressures and diabetes issues, right? They ate particular types of food, right? So my mom her family line was from the Southeast, right? Through the slave trade type areas. So she was a great cook, wonderful. And it included pig's feet, hog maws, chitlins, fat back with cracklins. She
the
was
basic
good.
4 food groups in Southern cooking. Yeah, I know.
She did good. And mac and cheese. She was great. She had it nailed. She was well known in our neighborhood as the cook in the neighborhood, right?
Right.
She also suffered from bilateral breast cancer, and other issues. She had a terrible medical history. My father had not quite as bad, but he had his issues too. And grandmother back had stomach cancer and just all kinds of things, high blood pressure, things like that. So theoretically, coming from that line, I should be riddled
with
issues. I am now 62 years old. I do not have any diagnosis. I don't have any medications I take. I eat fruits and vegetables, nuts, seeds, whole grains, beans, lentils, and mushrooms. I think that's all of them. That's what I get, right? I fully believe that food is medicine, really. And I've been doing this since I started studying herbology, really food as medicine, when I was about 17. So all of the food that we eat is either, you've heard this saying before, it's either working for you or it's working against you. I don't think there's any in between there. There's no food that's inert. We're not eating silver pellets that won't digest or something like that. All of it is impactful for the body. So we just best choice. And there's no guarantees in any of it. We know this too, right?
Right.
Stack the deck in your favor. Stack it in your favor. Eat the best food you can, as whole as possible, close as possible to the way it came out of the ground or off the tree. Avoid the processed mess and avoid the animal products, which is also full of processed mess. That's the best you can do.
Have you felt any compulsion to, like some of the docs do in the plant-based world, any drive to educate the healthcare providers themselves, in addition to the people that we're talking about? Do you feel to give back to the nursing profession or to the medical profession in some ways? That's something you feel some desire or drive to do?
So yes, because actually, Frank, it's hard for me to keep my mouth shut about any of this. So I talk about it all the time. So I'll give you 2 examples. When I was managing clinics, I told you that I built a culture around food, and it was healthy food all the time. At one point, not long before I retired, and it might have been part of why I retired, they hired a nurse practitioner to fill one of the provider slots. And she had a penchant, an absolute undeniable need to bake refined white flour, cookies, cakes, pies, everything. She came in 3 times a week, and she always brought some of this stuff. And she was so proud and so generous. And she and I we went toe to toe over, why are you doing this to the people here who already have physical challenges? They're already overweight. Everybody's trying to lose weight. So there was that. That was actually literal. It almost turned into a kind of a power struggle. Why are you doing this to the people that we care about? Why are you doing this? That was one. Fast forward now, I'm in the position that I'm in, and just maybe last month or so, we did a CME, basically continuing education units for nurses around plant-based nutrition and the impact it has on our health and the importance that we need to place on feeding children healthy food. So yeah, it's a constant conversation I have unofficially, and it is in fact something that I do professionally.
Tell me about your 6 million seeds program. I was kind of interested about that. Elaborate on that a little bit for us.
Okay, 6 million seeds is a project specifically about childhood nutrition. because, as we know, children are very poorly fed in this country. In fact, I was just looking up some statistics before we started talking. And like you said, so many people, what is it? I don't even, here are my statistics. So 1 in 6 children are counted as obese. 1 in 3 are just plain overweight or obese. So it's 33% of our pediatric population are considered overweight or obese, right? That's from the Harvard School of Public Health, right? The CDC says 283,000 kids now have diabetes, which is up from 24,000. What?
And remember that's a type 2 form, which is the one usually seen in people as they get older. We're talking about children, in a sense, aging at a rate like we've never seen before.
And developing streaks in their coronary arteries, right? Developing early signs of heart disease by the time they're 4 and 5 years old, some of them.
It's amazing.
The ideal diet is extremely rare in children. That's according to the American Heart Association. Something like less than 50% of kids consume enough fruits and less than 12% consume enough veggies, right? So we love our kids. No one's going to argue that. We want the best for them, right? But here we are sabotaging their health, right? I don't think any parent in their right mind would knowingly, intentionally, purposefully do this to their children. But here we are, right? We have these statistics, this data. So I woke up one morning with this understanding that if we don't do something for our children, we're going to be in really bad shape. And thus, 6 Million Seeds Project was born.
That's fantastic. That's really fantastic. So this is where, I feel your passion. I feel your purpose through all of this. So where does Meryl go with this next? Where do you see this going on the horizon down the road? What do you hope? What do you hope to achieve?
So thank you for asking. So it's a 3-legged project, really, right? One leg is we go into schools or educational settings because schools are super hard they're challenging environments, right? Teachers have a lot of demands on their time, and the school food programs are carefully controlled by the USDA. So it's hard to work with children in schools like that. But there's certainly after-school programs. There are faith-based groups. There's Boys and Girl Scouts. There's Boys and Girls Clubs, right? Work with children in those settings and teach them about whole food, plant-based eating, give them experience of how to cook it, how to grow it, how to all that, right? How to take it home and make a meal for your family. So we do that. The second leg of the project is a podcast that we do, which is also called 6 Million Seeds. I'm in my studio now. And that is about talking to adults from so many different perspectives around food. So it is talking to organic farmers. We talk to climate change activists. We talk to researchers. We talk to medical providers. We talk to parents. We talk to educators. We talk to everybody all around the impact of food on children's health and on the planet. The third leg is building a coalition so that we can actually all work together to move this message forward. Because if we don't collaborate, we're just going to stay kind of stuck. I feel like we've almost come as far as we can go working isolated in our little silos and, maybe loosely linking with each other for brief periods of time. And then we go off and do our separate things. And I totally understand every organization has its own mission and its own strategic plan and its own goals. I don't see how that is a conflict at all if we just want to keep our children healthy.
Oh, I think it's a necessity. I think we don't need to reinvent the wheel. I think collaboration is the way to go, that we can kind of stand on each other's shoulders and lean on the strength of the different organizations and bring it together for the outcome of the health and well-being of our children and this planet itself, which, of course, is going to require a real collaboration for us as a species, for sure.
Yeah, I am so grateful to the National Health Association for working with plant-based nutrition movement on this initiative. It's been a wonderful partnership that we've developed.
That's beautiful. Before we break, do you have any final words of information or wisdom you'd like to share with the audience?
just that it's so funny as plant-based people. I'm going to guess that some of your audience at least is already plant-based, right? And maybe here and there you get people in who are not, or they're just starting, or they're new to the experience. We forget that children need the same nutrition as adults, except with more calories, right? So many of us who are already plant-based, we're eating this way because maybe we had a diagnosis, or we're starting to feel overweight, or our digestive system is sluggish, or whatever reasons we have, and we still keep feeding our children chicken nuggets and French fries while we're eating salads, but we're giving them pepperoni pizzas and all that stuff. So just recommendation, right? Give the children the same nutritious food that you're eating yourself, and encourage them. And just keep in mind, it may take them 10, 20 times of testing a food before they actually accept it, but that's part of the process. Keep encouraging them to eat the vegetables, the fruits, the nuts, the seeds, whole grains, beans, rice, mushrooms. That's the main thing.
Well, I'm here with Meryl Fury, who is the president and CEO of the Plant-Based Nutrition Movement. And it was just a really delightful discussion. I want to thank you for sharing your time, your words of wisdom, and just really some really great ideas for how we could really start making some really major changes that need to be made. And on behalf of the National Health Association, I want to thank my audience, because without you, none of this could really happen. And I want to thank you for being part of this incredible active community. I'm Dr. Frank Sabatino. I'm your host. And I truly look forward to seeing you on the next show podcast. Thank you so much.
Thank you.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today, and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.